Okay. Hi, everybody. Good morning. It's Dr. Arafat from Vet Triage, June 20th, 6 a.m. Pacific time. Early stream because big day today. I'm flying over to California to work on a project. And henceforth, I have the Vet Triage garb on. So that's exciting. We're starting early. Anyway, I figured we could talk about specialty care in veterinary medicine. A lot of folks are unaware that such a thing exists in the field. So we will talk about it this morning. Again, as always, please subscribe, share, hit like. You can donate and all that good stuff. Any questions, leave it in the comment section. Happy to address any questions you have, or if you have any ideas for the next video for tomorrow morning, let me know. All right, so I am a board certified veterinary surgeon, specifically for small animals. And we will break down what exactly that means when you say you're a specialist. A specialist in the veterinary field and in the human side is a doctor who has underwent additional training in order to be focused on a specific aspect of the field. So, as a surgeon myself, I was part of additional training to become board certified in surgery, and specifically in small animal surgery. So there are other specialties. There's surgery, cardiology, radiology, dermatology, internal medicine, and it goes on and on, pathology, ophthalmology. So depending on the doctor's interests in the field, they can decide to focus their credentials on a specific specialty. And then most pet owners know veterinarians as, the family veterinarian or the regular vet, reg vet, we call them sometimes in the field. And those are general practitioners, GPs. General practitioners make up the majority of veterinarians, just like I think they do in human medicine, whereas specialists are much less common part of the field. So general practitioners are your regular vets, so to speak, that most people think of when they think of veterinarians. And then specialists like myself are focused on a specific specialty. Now, to say that you are board certified means that every specialty has a board. So, for example, for surgeons, it's in America, it's ACVS, the American College of Veterinary Surgeons. There's ACVIM, American College of Veterinary Internal Medicine, and so on and so forth. And these boards oversee the credentials and set the standards and the requirements for that specialty, for someone to be allowed to enter that specialty, as well as if they get any kind of medical board troubles or whatever, also upholding usually continuing education requirements, holding conferences so that the specialists can accumulate their continuing education requirements, so far and so forth. So when you say you're board certified, it means that the board of that specialty approved, confirmed that you fulfilled all the requirements for that specialty and then became board certified. There are some specialists that are titled board eligible. Board eligible implies that you've not yet fulfilled all of the requirements to become board certified, and you're still allowed to practice as a veterinarian, and you can even practice within that specialty, but you have to disclose to the public that you are board eligible. And so that's one phrase that's used. Another phrase that's used is special interest in surgery or special interest in internal medicine or something like that. The wording is on the board's websites, but they want you to delineate to the public that you have expertise beyond what a general practitioner would have in terms of that specialty specifically, but you cannot call yourself a board certified whatever until you fulfilled all the requirements, so the public knows that by your title, saying that you're board eligible, or you have an interest in the specialty or whatever it may be under your title as a doctor. So that's just kind of a brief overview on how that works. Now, when we're looking at small animal, because I had mentioned I'm a board certified small animal surgeon, as a veterinarian, you're allowed to work on any non-human primates on Earth. And to some degree, to a large degree actually, you can't even work on any primates, whether human or non-human. You can't work on any primates, even non-human primates like gorillas, chimpanzees, etc. You can't care for as a veterinarian unless you have special permits for them. I think it's because of all the communicable diseases between non-human primates and human primates. But in general, a veterinarian cannot work on humans, and they probably cannot work on non-human primates. Any other species is fair game. So, so in general, we divide the species into broad categories. Large animal usually includes equine, bovine. For the most part, a lot of us include pigs and goats and llamas and emus in that category. So animals that are large animal in size, and also more on can be more on the farm production side. But there are a lot of us who will delineate a large animal into like farm animal production animals, signifying those that we use for like meat, for example. So like pigs, um, and others are less livestocky, like horses are very specialty, and they don't really consider like livestock per se. But anyway, large animal implies that broad category of animals. Small animal implies usually dogs and cats, although you could throw in there animals such as gerbils, hamsters, ferrets, etc. But usually we have a subset of small animals called pocket pets, that are those that are tiny animals. So the guinea pigs, the hamsters, and there are also under that category to some degree. There's also exotics, and exotics can include some of the pocket pets like ferrets and chinchillas. It can also include a lot of reptiles. Um, those are a bit less common to have as pets, that you'll see like online and stuff like that. But there's also reptiles as a category, and there's also avian, which implies birds, and usually avian implies non-poultry birds, so the cockatiels and macaws, um, whereas poultry, chickens and turkeys. So there's broad categorizations of these animals, and then there are animals that are in more specific categories. So anyway, large animal, small animal, and so you can become specialized in large animal version of that specialty or small animal version of that specialty, because if you are looking to specialize in exotics or reptiles or avian, you're usually going to focus on the entire species and not just the specialty itself within that field. So, for example, if you're interested in avian, you're probably going to be dabbling in radiology, surgery, internal medicine, dermatology, etc. Because as far as I know, there are not board certified specialists that only focus on reptiles or avian or something like that. Whereas, generally speaking, broadly speaking, small animal specialties, large animal specialties. Okay, and then finally, why would you ever go see a specialist? Well, there are some cases that are going to be above and beyond what your family veterinarian, the GP, can work up. There are some where the GP has diagnosed a condition, but the procedure or treatment is beyond their ability to handle it at that clinic, and so they require a specialist to intervene. There are some surgical procedures, for example, that require additional training specifically to become certified in that surgery, like total hip replacements, for example, total hip arthroplasty, so the THR or the THA. And you have to not only be a board certified surgeon to be approved for that, but you have to undergo additional training to be licensed to do that. So, um, so some general practitioners legally can't perform procedures or treatments without the specialization. There are situations where the general practice just doesn't have the diagnostic tools, or maybe the pet owner is looking for a second or third or fourth or fifth opinion about a case because they're not happy with what they've been receiving, what information they've been receiving so far. So, why you go to specialty? Well, because you want a level of expertise that the general practitioner is unable or unwilling to jump into. There's no strict line otherwise. General practitioners are legally allowed to perform any procedure, diagnostic, whatever, on whatever species they chose, and they can switch species too in their careers as well. There are plenty of large animal vets who became small animal vets later on. There are plenty of small animal vets who became large animal vets. Um, but general practitioners are allowed to pretty much do anything that a veterinarian is allowed to do in general, except for those situations that I mentioned, like total hip replacement, that require additional training under a specialty in order to do that. But they're allowed to. It's just most general practitioners are so busy with the work they currently have for them to try and dabble with a more complex procedure or treatment or case is not worth their time and resources, especially if they're only going to perform that procedure or diagnostic or treatment like a couple times a year. Whereas a specialist sees that type of complexity all the time because everyone is sending every GP is sending cases to them. And then finally, how do you get referred to a specialist? You actually can. It's not the same as human field where you need to have a referral from a primary. For us, you just call them, make an appointment. They're going to ask for any previous records. If you don't have any, you don't have any. But most situations, you're being referred to the specialist by your family practitioner, your GP, but not always. Not always. You can just make the appointment yourself. So remember, you're the advocate for your pet, and if you feel like your general practitioner is just not doing it for you, either find a new GP or if you know what specialty you need to pursue, then pursue it, and they'll try to help you. The downfall to specialty is that they are few and far between. You might have to travel to get to one, even to another state or something, and they are going to be more expensive, even for the initial examination. They're more pricey, and there's usually a longer wait time for them as well. So pros and cons to everything. This whole conversation was focused on the United States of America. So I don't have enough knowledge at this point to talk about other countries, but hopefully it gives folks an overview for what specialty means in the veterinary space. So thanks again. I saw we had 2 audience members today, so that's exciting. That's wonderful. I'm not sure who they were, but thank you for attending. And hey, look, we already doubled our audience members since yesterday, so that's great. I will see you guys again hopefully tomorrow, June 21st, in the morning, and we'll take it from there. Again, please donate, subscribe, hit like, share, do all the things, and I look forward to the next live stream. We'll see you guys soon. Thank you. Take care. Bye.